morning, good afternoon, or good day to all of you. Thank you for viewing today. Today is another day that I want to talk about a very important topic about breastfeeding, okay? So today is another knowledge day. One of my subscribers messaged me and asked me questions about how can she identify or how can she tell that the latch is shallow, meaning the latch is not deep. How can she identify? And this is the first time mom breastfeeding. She's been breastfeeding for 3 weeks. So she's trying to figure out how can she adjust the latch and how can she identify if she's doing it right. So today I'm going to tell you some of the strategies and what are the things that you need to observe when you are breastfeeding. So here's the thing. Every time you hold this baby, whatever position you're doing, favorite position that you are using when you're breastfeeding, always remember that when you are trying to get that deep latch, that perfect latch, it's not just the baby who's gonna be doing the adjustment on that. It is how you position yourself when you're sitting in your couch, or when you're maybe laying in your bed or sitting in your bed, or wherever you are when you're breastfeeding. Always consider the comfort, the positioning to get that perfect latch, okay? Because it doesn't, especially when your baby is only like weeks old or maybe 2 or 3 months. But when baby gets older, you can do whatever positioning, whatever technique you can do, because during that time you're already very familiar with what's not to do, what's to look for. But if you're a beginner, it's very important that you have to pay attention on how comfortable the baby is and how comfortable you are to get that perfect latch. Now, many times when I teach a prenatal class, I've always demonstrate to mothers or to pregnant women on what's the best position that you can get, especially if you are first time breastfeeder. Now, consider your size, consider the length of your arm, consider the weight and the weight or the heaviness of this baby. Also consider on how comfortable you are. These are the things that you need to consider when you want to get that perfect latch, okay? Now, if you have a big baby, so this baby is like 10 pounds. So my baby, when I gave birth, was 9.4 pounds, like more than probably the size of a 1 month old for a smaller baby. But I have a big baby, so because I'm a bigger woman, I have a longer arm, so it was comfortable for me to hold my baby. But my problem at that time was I couldn't get that deep latch because nobody taught me. I wasn't a lactation consultant then. So always consider the weight of your baby, the length of your arm, how comfortable your chair is, and how comfortable that positioning that you're using right now. Now, when you do football, make sure that you have a pillow underneath to support your arm, not the baby. This is always the mistake, that if you watch my video about what breastfeeding pillow is used for, you watch that one because it's very important. Now you need to, when you do football and you're just first time moms and the baby is still kind of unstable when you're latching, make sure you have a pillow that supports your arm. If you are using the cradle hold, make sure you have also a pillow, not breastfeeding pillow. You can use any regular pillow to get that perfect latch. Now, going back to the question, how can you identify that you have that perfect, you get that deep, perfect latch? Now, if you feel like that when you're latching the baby and the baby comes on and off, keeps sliding away from your nipple, from your breast, that means the baby did not really get the full breast tissue of your breast. And you can identify this when you're, let's say, even few minutes, even 5 or 10 minutes after you latch. You can identify this. Did the baby really have the full crabs of your areola, or just the nipple itself? Because if you feel like that the baby's mouth or lips is just around your nipple area, that means it's a shallow latch. So you need to readjust the latch. And this is most mistakes that I've seen when I help breastfeeding moms, that when they adjust the latch, they just take the baby's mouth right away. No, what you need to do is put your little finger, insert it inside your baby's mouth, and open the baby's mouth before you take out the mouth away from the nipple. Because if you keep doing that, that just pull the babies out straight from your nipple gonna be sore by the end of the day, because the baby's mouth is still there, sucking the nipple, and you're just pulling it away. Make sure that you insert that little finger inside the baby's mouth, start with the side, open the baby's mouth, and let go your nipple. That's the safest way on how you can protect that nipple tissue, because our nipple tissue is very sensitive, especially if you're just first time breastfeeding, or even during your first week of breastfeeding. Your nipple is still very sensitive, so be very careful with that. Now, how can you identify that your latch is shallow? If you feel like you breastfeed for 20-30 minutes and the baby's still hungry, the baby's still showing you the hunger signs, and you feel like the baby is not satisfied, that means your latch was shallow. Another thing that you can identify that the latch is not good is when you look at your baby, when this baby is sucking. If the baby's mouth is empty, the baby is sucking, but there's less milk, you may see a dimple right on the baby's cheeks, okay? Like this, meaning the baby's mouth is empty, okay? So how can you improve that to make sure that the baby is sucking and the baby is getting your milk? Is do a massage, manual breast massage, at the same time baby is sucking. When you do that, you're helping the baby to get more flow. You're helping your baby to stimulate your breast nerves so that it will produce more milk while the baby is stimulating that letdown, okay? So always remember, when you're breastfeeding, avoid any distractions. Like, I know some of you probably wants to use your cell phone while you're breastfeeding, but you may miss those signs that it's very important for you, the signs that baby is not getting enough milk. When you see this dimpling, that's a sign that the baby is not getting enough milk. It's called non-nutritive sucking, meaning the baby is sucking but not getting the milk. The nutritive sucking is the sucking that it's deep and you can see the baby swallowing, okay? Now, another thing that you have to pay attention when your latch is shallow is you may hear a sound clicking, like that means it's just that the baby's tongue keeps sliding around in your nipple that has no milk, just sliding. Clicking sound also is indication that the baby maybe have tongue tie. That's why the latch is shallow. Sometimes there's a noise. You can hear a little bit of noise, like kind of unusual noise when you're breastfeeding. That means the baby is not really getting the milk. It's just the sucking sound that you're hearing, okay? Now, another sign that your latch is shallow is that your milk supply is slowly declining every week. And then when it comes to months, and if you're not paying attention to your milk supply, it may decline slowly and slowly, because the milk transfer gets really low when the latch is shallow. When the latch is deep, there's more stimulation, there's more nerve signals to your brain to release oxytocin and gives you the lots of letdown. So the deeper you go, the deeper the baby's latch, the more stimulation and the more letdown that you get. Another thing that's very important that you can tell that your latch is shallow, when your nipple is starting to get really sore. There's a reason why your nipple is sore. Either it keeps rubbing on the baby's gum because the latch is poor, or it's just the baby is just sucking in the nipple area, that's causing the soreness of your nipple. Now, I probably showed this before, but I'm just gonna show it to you again. Now, look at this brush, okay? This is a brush. When you breastfeed for like 20 minutes and you remove your baby's mouth, when you look at your nipple, if the tip of your nipple is like this, like flat in here, that means your nipple, your latch is very shallow, that the baby did not get that full transfer of milk. Another thing that really demonstrated to you on how to look at your nipple after you breastfeed to identify if your latch is shallow is look at the shape of this lipstick. So this lipstick will tell you that if your nipple shape is like that when you unlatch your baby, meaning your latch was poor. Your latch was too shallow, it was too shallow. That's why your nipple is pinched. I want the nipple to be shaped like a round nipple when after you breastfeed, because that's a good indication that your latch was deep and it's not shallow. Now, I want the shape of the nipple to be like this when you are unlatching your baby, not the shape of that lipstick. Because if you keep doing that, if you keep not paying attention to your nipple when you're breastfeeding, later on, weeks after or maybe days after, your nipple gonna get sore because of the shallow latch. Another last thing that you need to, you can tell if your baby latch is shallow, it's like the baby is not pooping well, is not peeing good. That's an indication that the baby may be latching there, but you were not able to identify how deep was the latch. So baby was breastfeeding maybe for 30 minutes, but yet did not get enough milk. So the number of pooping went down, the number of peeing went down. So this is how you can tell. If your latch is perfect, your milk transfer continues to increase. Baby's poop continues regularly, like 3 or 4 times a day. Wet diaper 3 or 4 times a day, or maybe more. Again, sometimes when you breastfeed, after you breastfeed, the baby will poop. That's how breast milk is, how easy it is to digest. When you're formula feeding, it may take 3 hours before the baby would poop. It's not as regular as breastfeed babies, okay? So don't be surprised that you're formula feeding, your baby looks very healthy, but yet it's not pooping every day regularly. Because again, one risk for formula feeding is constipation, okay? That's proven research that it is really, some babies get constipated. So I hope you learned something from this video. Share this video, because I know there are so many moms out there who just confused, who just can't tell, who just don't know how to identify if their latch is shallow, and what are those indicators that needs to be improved if the latch is really shallow. So share this video, do your comments, ask me questions, so that you'll be able to learn more about if you're breastfeeding or if you're formula feeding, and what are the things that you need to know when it comes to feeding your baby and making your baby healthy, as well as yourself. So I hope this video will help you. Share, continue to subscribe. Thank you for continued subscription. I promise every 2 to 3 days you'll have videos that will help you in this journey of breastfeeding and formula feeding and even pregnancy. Bye for now. Thanks again for watching.